It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care to long-term ventilated patients and medically complex patients at home. In last week's blog, I talked about my 18-month-old daughter has a very complex medical history. She has a tracheostomy and is stuck in the pediatric ICU. What can we do to get my daughter home? You can check out last week's question and blog by clicking on the link below this video. So in today's blog post, I want to talk about, can intensive care at home train family members to look after their loved ones on a ventilator and a tracheostomy? This is obviously a question we get very frequently from families that come to us that have a loved one in intensive care or have a loved one at home on a ventilator with a tracheostomy already, whether we can train them. And especially if they have their loved one at home already, they're often going back to ICU quite frequently because they don't have the specialist care required. So families also ask the question if their loved ones only have a tracheostomy or are ventilated with BiPAP, CPAP and don't have a tracheostomy. Now the short answer to these questions is a clear no, and I will evaluate on it. So when someone is having a tracheostomy, is having a ventilator, it takes years of training to look after someone on a ventilator with a tracheostomy. It also takes years of training to look after someone with a tracheostomy only that's not ventilated. Now, I would argue that 99% of patients with a tracheostomy when in hospital are in intensive care, and in intensive care doctors, nurses, etc. need to go through specialized training to work in intensive care, and that includes looking after ventilator, looking after tracheostomy. The reason why someone is in intensive care if they're on a ventilator and a tracheostomy in the first place is simply that their life is in danger and that it takes those specialist skills to manage maintaining a ventilator and a tracheostomy. The risk for a medical emergency is huge when someone has an artificial airway, which is basically what a tracheostomy is. Also, if someone is ventilated without a tracheostomy and they're on BiPAP or CPAP ventilation, they're still on a mechanical ventilator, and the reality is that the risk that something is going wrong when someone is on a ventilator is very high, and therefore people need to know what they're doing. The best analogy that I can make is when someone is on a ventilator and a tracheostomy or both, if you're not having intensive care nurses or intensive care doctors manage that, it's like flying a plane with a cabin crew and not with a pilot. So therefore, we are unable to train families because you need to understand anatomy, you need to understand physiology, you need to have seen emergencies and how to successfully manage them. And unless you've done this numerous times, like we all have here at Intensive Care at Home, where we employ hundreds of years intensive care nursing experience, we just can't pass on that intellectual property in a quick training session, because as I mentioned, this takes years of experience. I'll give you some practical examples here so you can understand why I'm saying what I'm saying. Number one, on our website intensivecareathome.com, we have published the home mechanical ventilation guidelines. Now, if you look at the home mechanical ventilation guideline, it clearly demands, not suggest, it clearly demands that when someone is having a ventilator and or a tracheostomy at home, they must have intensive care nurses or critical care nurses 24 hours a day, full stop. Now, those guidelines are a result of having performed intensive care at home services for the last 25 years, predominantly in German-speaking countries, but now also in Australia for the last 7 years, where we have certainly proven our concept without the shadow of a doubt. But to put this even in more practical terms, last year, in 2020, we had 3 clients pass away within a very short period of time, just before Christmas in 2020. Now, all 3 clients had a tracheostomy or were ventilated. Now, all 3 clients only had limited intensive care nursing support at home. The clients were only funded for predominantly night shifts or were only funded for a few hours here and there. Now, we have highlighted this from day one to the funding body that the clients are at risk of dying because there is no 24-hour care. We were making reference to the home mechanical ventilation guidelines. Again, this is evidence-based guidelines from the home mechanical ventilation guidelines that anybody as anybody on a ventilator and a tracheostomy needs to have intensive care nurses 24 hours a day, full stop. And anywhere where this can't be provided, clients are at risk of dying in a home care settings. So we were only funded for night shifts for those clients, and all 3 clients within a very short period of time passed away. During the daytime, when no intensive care nurses were present, they passed away because of medical emergencies that could not be managed by families. Now, these were tragedies beyond my words here. The pain that the families have experienced, and our experience here, is huge, but also the pain that we feel as a service provider, the pain our nurses and myself have gone through by losing those clients, because 2 out of those 3 clients were children, and it still breaks my heart to this day that those clients are no longer with us. 2 out of those 3 clients, especially the children, were at their peak of their health since they were discharged from intensive care. And again, it is beyond my words to describe that those children in particular are no longer with us. And whilst the NDIS scheme here in Australia has come a long way in terms of funding nursing care for long-term intensive care patients so that they actually can go home, there are still gaps in the system. And those gaps in the system have cost some lives and are costing some lives, especially of children that shouldn't have been lost in the first place. And that is the very reason why we can't train families, because those families as well were not in a position to manage those medical emergencies. And that is the main reason why those clients are no longer with us. So I hope that answers your question for today, and let me know what questions that you have and I can answer them here. Thank you so much. Now, if you have a loved one in intensive care and you want to go home with our service, Intensive Care at Home, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of our website, or simply send me an email to patrick@intensivecareathome.com. That's Patrick, just with a K at the end, P-A-T-R-I-K. Please also have a look at our case studies, because there we highlight more about what we can do for our clients, how clients can live at home with ventilation and tracheostomies, and you can look at our case studies as well as our service section. And if you are at home already and you need support for your critically ill loved one at home, and you have insufficient support or insufficient funding, please contact us as well. We can help you with all of that. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have completed a postgraduate critical care qualification, please contact us as well. Check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, in Bittern, Frankston area, South Gippsland, Warragul, Trafalgar, Druin, as well as Wollongong and Wagga Wagga in New South Wales. We are also an NDIS, TAC and DVA approved community service provider in Australia. Have a look at our range of full service provisions. We also have been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare services. Thank you for watching this video, and thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you in a few days.